Hi. Hi again. So they let me back into the bone room so I could do some more skeletal stuff for you. So I have here this lovely skeleton. If you were in the bone room, I would always tell you to get the one that says female, skull female, because for some reason or another, the female ones you can see a lot more of the parts inside, a lot more of the features. So I don't know why. These are all plaster casts. They're not real skulls. They're plaster casts of skulls. So I guess the plaster cast just turns out better with the female skulls for some reason. But I just wanted to go over quickly. Let's do the first section of this just real quick. Um, so here's our skeleton. Hello. How are you? I'm going to take this jaw off for right now. So we're going to look at the lateral view. See, this would be the anterior view. Anterior means front facing. The anterior view, so the lateral view would be out to the side. So we're going to go over the parts of the skull. And what I want you to first notice on this skull is if you can look at these lines right here. You see how these lines come out here? Don't pay attention to the screws, that's just to hold it together. But there are all these lines. Now here's the posterior view. This is the back. See these lines that come up and go down? This one goes straight down the center, so that would be a sagittal plane cut. These. And then this one is in the front. See, so if you look down here, these are all called sutures. And when you're born as a baby, they're separated. These are loosely connected. And then as you grow older, they harden and they form together. And this is actually considered a joint, even though they don't move. They're kind of fused together now. But the fused together joints where they don't move are called sutures. So if you look at the lateral view, here's the lateral view, you can see this. Here's your ear hole. This is the external acoustic meatus. And if you can see this suture going around here, this sort of looks like if you were to, like I have headphones on, and if you were to wear those big, huge headphones, those noise-canceling headphones over your ears, that would kind of be the exact same lines. That would be around the exact same place as this suture going around here, going around your ear, your external acoustic meatus. And that is the temporal bone. So this section of the skull is the temporal bone right here. And this would be the squamous suture. The name of the suture would be the squamous suture. And that outlines this bone. So see, you get a lot of hints with the skull because the sutures will outline the different bones in the skull. So you can actually tell pretty easily where the bone begins and ends. So this is the temporal bone right here, and this is the squamous suture outlining it. Now, if you look at the front, and I bend her down a little bit, you can see this frontal cut going right across here. This is the frontal or the coronal suture, and coronal just means crown. So right where you would wear a crown on top of your head, that's where this suture is. So this is the coronal suture, and that divides this whole forehead, which is called the frontal bone. And the frontal bone comes all the way down to the tops of your eyes. And then it turns into different bones, your facial bones. So, but this whole forehead part, this is your frontal bone. Now, as you can notice, and I'm holding it up at the top now, this is the superior view because we're looking down at the top. So this one that goes back, the sagittal cut, is the sagittal suture, and sagittal just means from front to back. And that's with two T's, by the way. And that divides two parietal bones. You have your left parietal bone, because remember, it's always on the patient's left or right. Not your left or right, it's the patient's left or right. So you have your left parietal bone and your right parietal bone. And see, if you follow this parietal bone all the way down, it goes into the squamous suture and turns into your temporal bone right there. Now, if I turn this skull all the way around to the back, you see this big triangular kind of suture. This is called the lambdoid suture. L-A-M-B, like a little lamb, and then D-O-I-D, lambdoid suture. And that outlines this whole back of the bottom back of the skull, which is called the occipital bone. So this is the occipital bone in the skull, and this goes all the way down. I showed you in the other video when we were going over the vertebrae. This goes all the way down and covers your foramen magnum. That's where your vertebrae comes out, your spinal cord comes out. The foramen magnum, a foramen just means hole, and magnum means big, so big hole. And right on either side of this, if you can see this, there are these little flat surfaces, and that's where your vertebrae rest on your skull. Your skull just sits there on top of your vertebrae. And those are the occipital condyles. A condyle is just a flat part of the bone where another bone connects to it. Or, because you need to have it flat when bones connect to it, because if it was rough, it would be rubbing on itself, and that would be painful if you had a nerve there, or it just wouldn't be good for the bone. So it's flat, so the flat surface, so the bones can connect without any problems, and that's called a condyle. And so these little flat surfaces, they're in the occipital part of the bone, or the occipital bone of the skull, and they're condyles, so they're called occipital condyles. Now we can go to the front of the face, the front of the skull. This is the anterior, A-N-T. When I first started taking anatomy and physiology, I always thought that they kept saying interior, and I'm like, what do you mean interior? This is the outside, this is the exterior. And it's like, no, anterior, meaning the front of it. You're looking at the anterior part of the cranium here. So here is your, you have your eyes, your eye holes, your nose holes, and then I have the jaw down here. So let's start with the jaw. Here is the jaw, as you can see, and this is called the mandible. The mandible. So this is the entire jaw is called the mandible. So that's pretty easy to tell where the bone begins and ends, because your entire jaw is called the mandible. And not to be confused with your mustache, I always call it the mustache bone, and that's the maxilla. So the mustache bone is the maxilla, because a guy named Max would have a mustache. I don't know. As I said before, this is your frontal, your whole forehead up to your coronal suture is your frontal bone. And then see your cheekbones? Your cheekbones are the zygomatic bones. And they actually curve all the way back to your temporal bone. And it connects your temporal bone to your zygomatic bone. And these are your the apples of your cheeks, and then your cheekbones going all the way back to your ears, pretty much. Now, it's good to notice that your mandible, the jaw, your mandible will be one bone, but your mustache bone, the maxilla, is going to be two bones, because if you can see right under the nose, I don't know if you can see that or not, there's a little tiny, teeny tiny line dividing the two. So actually, you're going to have your right maxilla and your left maxilla right here. So these are going to be two bones. Your maxilla is actually two bones. Also, you have the vomer, which is just this little triangle that goes back into your nose, and then your nasal septum is going to go all the way up, that divides the two cavities, your two nasal cavities. So these would be your nasal cavities. And up here on the top, there's, I don't know if you can see this either. See how your frontal bone ends right here? There's this little indentation. That's where your frontal bone ends. So your forehead, where your forehead ends is where your frontal bone ends. And then there's a dividing line down the center, and there's two bones on either side on the top of your nose. And that would be, just my nose on the top. And those are your nasal bones. Now, there's a couple of bones that you're not going to be able to see inside or outside of the skull, and you can see them, you can actually see them if you look way far into the eye here. You can see the palatine bones, and they're in there, and you can kind of see the inside of the nasal, or inside of the orbitals. You can see the you can see the lacrimal bones. Lacrimal means tears, so just think of them, that's where your tears come out, so that's where your lacrimal bones are going to be. The palatine bone's in there, and you can also see your ethmoid bone. Also inside of the skull, you're going to be able to see your sphenoid bone, and you're going to see the top of your ethmoid bone. But your ethmoid bone, you can't really see from the outside of the skull ably, because inside the skull, inside of the nasal cavity, all of those, if you look inside the nasal cavity, all of those little bones are all one part of one bone called the ethmoid bone, and it goes straight down inside of your nose down to the roof of your mouth where the palatine bone is. And the palatine bone is kind of the roof of your mouth, in that area right there. Now on the back of your skull, in the occipital bone, you can see these kind of lines right here. You can see this, here's a line right here, and here's another indentation right here, this line. These are nuchal lines, N-U-C-H-A-L. And nuchal in French means the nape of your neck, just the back of your neck, right where your head ends. So that's your nuchal lines. So it's right here where the nape of your neck would be. The back of your neck would start right here and go down. So those are nuchal lines. This little notch right here, this little nub that sticks out, is called the external occipital protuberance. And it's external, it's on the outside, it's in your occipital bone, so external occipital. And protuberance is just another word for a little nub that sticks out. It protrudes, so protuberance. And this entire row going down where these lines all meet, and it goes down and forms this little crest, well, you guessed it, that's called the external occipital crest. External because it's on the outside, occipital because it's in the occipital bone, and it's a crest. Now if we look back again on the side, on the lateral view of the skull, you notice that, see, right here would be the foramen magnum, the big hole, and that's where your spinal cord comes out, your vertebrae. And right here, you notice there's this big bump right here. And anytime a bone sticks out, pretty much, a part of a bone sticks out, it's usually referred to as a process. So this is no different, and it's called mastoid. So this would be the mastoid process. Now here's your ear, and here's your external acoustic meatus is the technical term for it. External because it's outside, acoustic because you hear with it. Meatus just means an entrance to a hole. And so right down here, a little bit lower than it, is your mastoid process. And right next to the mastoid process is this little thing that sticks out, this little pen-shaped, nail-shaped thing that sticks out. And it kind of reminds me of a stylus, you know, that you write on your iPad or something. And guess what? This is called the styloid process. Process because it's part of a bone that sticks out, and styloid because it's in the shape of like a stylus. I don't know if that's why they actually named it the styloid process, but that's what it reminds me of. That's how I remember it. So styloid process. Now let's take the jaw for a minute and go over the jaw. Um, you have on this jaw, as you can see, there is an angle right here. This is called the mandible, remember? And there's an angle right here, so that's called the mandibular angle. And up here at the chin, you see how it sticks out a little bit? And I don't know if you can see that. Let's get something behind it so you can see. You see how the bottom of the chin that sticks out a little bit? Well, that's called the mental protuberance. Remember, protuberance is something that kind of just juts out a little bit. It's not a process. It doesn't stick out a lot like these do up here, but it protrudes. So this is the mental protuberance. Now, alveolar processes are, if you ever notice, well, here's your teeth, right? So, but if you ever notice, I think there's a good view from the front. Yeah, there we go. See how below the gum line on your teeth, it kind of looks like there's teeth underneath there. The teeth go underneath there, you know, where your roots are. And where these teeth stick, the underneath the gum line sticks out, are called your alveolar processes. Your alveoli are alveolar processes, alveolar, if I'm pronouncing that correctly, alveolar processes. Now, a word on your cheekbones. Now, do you remember what your cheekbones are called? There's zygomatic bone with a Z. Zygomatic, which is a funny word. And those are your cheekbones, and they follow this arch all the way back to your temporal bone. Let's get up on the close-up camera here. See, here's your cheekbones. Right here. Here's the apples of your cheeks. And then there's this arch that goes all the way back and turns into your temporal bone. And if you can see, if I hold this down a little bit, you can see that this arch is hollow. There's this little, it really is an arch. There is nothing underneath there. So this is called the zygomatic arch. Now, zygomatic is your apples of your cheeks, the zygomatic bone, and then it's the zygomatic arch. And then where the two meet, there's the temporal bone kind of arches out and meets it halfway. So where the two meet, they're called processes. But you have to remember this. The zygomatic process is actually the part of the temporal bone that sticks out. And the temporal process is part of the zygomatic bone that sticks out right here. If you can see, there is a little dividing line right here on the skull. So this little square part that sticks out, that forms the arch, is your temporal process. And this section of the arch that sticks out and turns into your temporal bone is actually called the zygomatic process. So they're reversed. The names are reversed. So the temporal process is on your part of your zygomatic bone, and the zygomatic process is part of your temporal bone. Now, on the mandible, I want you to notice these two processes that stick out. This back one is the one that attaches as your jaw, that attaches between the mastoid process and the styloid process. The back process of the mandible comes in between there, and that's how your jaw, oops, and that's how your jaw operates. So if you look at the mandible, this back part, this process, it's a process because it's part of a bone that sticks out, is called your condylar process. And remember the word condyle I was talking about? These are condyles because they're a flat, smooth section of the bone that attaches to another bone. This is just, it's called the condylar process. So you don't have to memorize any extra words for that. This condyle, this process with this condyle on it is called the condylar process. This notch in between the two processes is called the mandibular notch. And then this front process that sticks out, the coronoid process. This process that sticks out in the front that doesn't attach like to the jaw, because the condylar process is the jaw. Now, if you notice on this mandible, remember I said there's this mental protuberance there, just the part of your chin that juts out? Well, there's this little hole right above it, and it's usually on both sides of the mandible, this little hole right above the chin, where the chin juts out on the sides. That's called the mental foramen. Remember, foramen just means a hole, and this is the mental section of your jaw. The mental is just your chin. So this hole, these holes right above your chin are just called the mental foramen. Now inside you have another hole. Let's see if I can show you. There's a hole right here, and that's just called the mandibular foramen. Now let's look inside the skull. Here's the fun stuff. If we look inside the skull, we're going to be able to see the top of the ethmoid bone and the sphenoid bone and a whole bunch of holes. So all these holes, most of them are called foramen, because foramen just means a hole, and things go, like vessels go through it, just depending on which hole it is usually. So this is the foramen magnum, as I said, which just means big hole. On either side of the foramen magnum, down in here where the hole is, there are teeny tiny holes, and those are called the hypoglossal canal. If you can see this, let's see, right above my finger, it looks like kind of an indentation. It doesn't even hardly look like a hole, but that's called the hypoglossal canal. That's where your hypoglossal nerve runs through there. And then right next to the foramen magnum, remember, is your neck. That's where your spine goes down. Right next to that is this big hole here, and this is the jugular foramen. Foramen just means hole. Jugular means your jugular goes through there and down your neck. And see how this pipe cleaner is coming out on the other side, on the underside of the skull. So that's your jugular foramen. And jugule in Latin, sort of kind of, I'm abbreviating here, but sort of kind of means next to your neck. So your jugular is next to your neck. So this is your jugular foramen, which is the hole that your jugular goes through. And then you come up right next to the jugular, and there's another hole right here. There we go. There's a little indentation here. And this is your internal acoustic meatus. Remember, your external acoustic meatus is your ear hole, right? That's the external part of your ear hole. Well, next to the jugular, right here, this indentation, this goes into your ear, because see, this bone kind of raises up right here. This whole bone is raised up. This is called your petrous portion, this part of the bone. And inside are your ear bones, is all of the stuff that lets you hear. And I went over it on another video on the skull. The three smallest bones in your body are in here. The malleus, the incus, and the stapes. And those bones are what vibrate and carry the sound waves to your brain so you can hear. And so this is your internal acoustic meatus. This is the hole that goes into your ear on the inside of your skull. Now you go over the hill, over the petrous portion, and there's a big hole right here, and that's your carotid canal. And your carotid canal is right on the other side of the hill from your jugular foramen. Your carotid canal, you guessed it, has your carotid artery going through there. If you slide up just a little bit and get more toward the center of the skull, then you get your foramen lacerum. Foramen lacerum. And if you notice, that's right here next to the seat inside your sphenoid bone, which we'll get to that in a minute. Now, if you look next to up here, there's your foramen lacerum, your foramen ovale, which is an oval, and right next to it, this teeny tiny hole, is your foramen spinosum. So let me see if I can hold this back here so you can see the holes better. So the teeny tiny hole is your foramen spinosum, then that oval hole is your foramen ovale. Now, if you notice in here, there looks like there's these giant bat wings that come up. It looks to me like the bat symbol from Batman. And this is your sphenoid bone. So this is, remember I was telling you that you can't see your sphenoid bone from the outside of your skull. Your sphenoid bone is in here. And so these big bat wings are your greater wings, and then these on top are your lesser wings because they're smaller. Now, right up here, where it looks like this is the bat head. Right up here are some more holes that go through, and if I can get this through, let's see where it comes out. Oh, look at that. See, that hole comes out through your eye, and that's your optic canal. So you have two of them, one for each eye. So optic canal, right there. And it looks like the little ears of the bat head or something in this big bat symbol, which is your sphenoid bone. Now up here, as you can see, there's this thing that sticks out. It's a crust. It looks kind of like a shark fin, and that's called the crista galli. And it sits on just, if you draw a little invisible rectangle around the crista galli, that's called your cribriform plate. So this entire invisible rectangle that you draw, that you can draw around this shark fin, this crista galli, your cribriform plate and your crista galli, that's the top of your ethmoid bone. And if we look, that's right on top of where your nose is. If we would go down in there, then we would be going down inside your nose and down to all of these little bones inside of here. So that would be, that whole thing inside there is your ethmoid bone. You can't really see it from the outside unless you like look up somebody's nose, or there's a little teeny tiny portion of the ethmoid bone in the inside of your eyes right here. Kind of the walls of the inside of the eyes is your ethmoid bone behind your lacrimal bone. So that's your ethmoid bone, and then again the big bat signal is your sphenoid bone. Also in the bat signal, if you look at the little head, it looks kind of like a saddle. If you can see that, if you turn it to the side, it looks like you can kind of sit in there. See where I'm putting my finger? There's this indentation. So this whole thing is the sella turcica. Sella turcica. And that's the kind of the bat head of the bat symbol, or it's an indentation here. I can set my finger right in there, and it looks kind of like a saddle, like a horse saddle that you can sit in. Sella turcica. Now underneath, if we're looking, like here's the head, and we're going to look underneath with the jaw removed, like here would be the jaw on here. So we're just going to take the jaw off so you can see inside the mouth. There is this little indentation right here, this little indentation, and this is the back of the roof of your mouth, and that is the palatine bone, or palatine bone, whichever way you want to pronounce it. This front portion of the roof of your mouth is still your maxilla. Remember the mustache bones? Because some guy named Max would grow a mustache, is how I remember it. So here's your left maxilla, here's your right maxilla. Inside of here, you can kind of see where the two maxilla bones fuse together, and the roof of your mouth right here is still your maxilla, but the back of the roof of your mouth is this little horizontal piece, that's your palatine bone. Okay, and I think that's about it for your skull. It wasn't that bad, was it? Um, I think we might be missing, depending on your teacher, they might have you memorize a few more holes in your skull or a few less. So I'm not sure. I have the diagrams that I'm working from, and these are covering the major parts. If you understand these and you can see them on the models, then you're going to be able to look at the diagrams your teacher gave you, and you're going to be able to, tell where everything's at, and then any additional features of the skull that your teacher wants you to memorize. At least you have these down and you see where they are, so you can memorize the other ones in reference to this. But you are always welcome to email me or just leave a comment in the comment section. And don't forget to subscribe. And I will see you next video when we go over some other parts of the skeleton.